Hi, Kelly. Well, the German company is saying it's shipping that test to the United States this week to potentially begin to be used. There are a lot of good things about this test. Now, it can return results in about an hour, as you said. It tests not only for the coronavirus, but also 20 other viruses that cause respiratory infections, including flu and the other coronaviruses that we associate more with colds. It is installed in about 1,100 instruments around the world in hospitals, labs, and clinics. It can be run on those instruments, including about 200 in the United States. So there's a question about how widely will this be used and how much capacity will it add to the system. Additionally, Qiagen is a major maker of the RNA extraction kits that are used to run the coronavirus tests from other companies as well. So we've got a lot of questions about this, and joining us to answer those is Qiagen CEO Thierry Bernard. Terry, thank you so much for being with us today to talk about this new test. And let's start there. How much capacity will this add to the U.S. system, do you think?
So thank you very much, Meg, for this invitation again. I mean, we have been ramping up our manufacturing capacity to 3 shifts per day and 7 days a week. So we are really ramping up the manufacturing of that 1 hour time to result solution. However, I would like to insist on something. This is not just about Qiagen only. It's about the extremely good cooperation of so many diagnostic companies currently, not only for the US, but also worldwide, to bring together solutions for testing more and more people as we speak. Qiagen alone could not be currently answering the entire needs in the US. No, any other company could do that on a standalone basis, but all together, between companies like Roche, Thermo Fisher, Becton Dickinson, bioMérieux, and Qiagen, with all the solutions that we are bringing. Cepheid also just announced that they would bring a test as well. All together, we are going to really be able to answer the needs.
And a lot of folks have commended the commercial industry for really stepping up, especially as we saw those delays with the government tests at the beginning. How much do you anticipate that the Qiagen test that you're shipping out to the U.S. this week will be able to add in terms of capacity?
Well, I have the ambition, we have the ambition as a company to ship thousands of tests per week. And again, it's together with the other companies that we will have the capacity to really answer the needs. But as far as Qiagen is concerned, we are really betting now on thousands of tests to be shipped to the US a week.
And Qiagen also plays an incredibly important role as a manufacturer of the RNA extraction kits, which are necessary to run the tests. We understand you are dramatically ramping up capacity of those kits in order to be able to supply everybody who's needing to run these tests. Where does that stand now? Can Qiagen meet the current needs?
Well, once again, we are several companies manufacturing those RNA extraction kit, viral extraction kit, and all of us are ramping up manufacturing capacity. Once again, 3 shifts a day, 7 days a week. As far as Qiagen is concerned, we are on our way to be able to manufacture around immediately for the month of April, or 10 million of patients per month, ramping up quickly around May to 20 million patients per month based on those RNA extraction kits.
Right. So by April, 10 million potentially a month that you can be supplying. Right now, are you hearing from clients in the field who are processing all of these tests that they don't have enough of these supplies?
Indeed, if they are just referring to only Qiagen, like many other companies, we are in allocation of product. The fact that we have ramped up dramatically those manufacturing capacity doesn't mean that we can answer everybody to their full needs. So we are in allocation. We are not in back orders. We are delivering every laboratory in the US, probably not to their full request. But again, it's together with other companies. And in the case of extraction of nucleic acid, together with Thermo Fisher, together with Roche, that we can answer the demand all together, not one company. It's a common effort from the diagnostic manufacturers.
All right, Thierry Bernard, we really thank you for joining us.